right. Welcome to the CCC News podcast. I'm Tom Peterson, and today we're talking about mental health, a linchpin to positive, productive, and purposeful living, kind of living our best lives, right? And so that's much easier said than done. And today we're joined by Stephanie Becker, a licensed clinical social worker and mental health therapist from Hood River, who is also involved in the Columbia Gorge Behavioral Health Consortium. Thank you for coming, Stephanie.
Well, thank you for having me. I'm really excited to be here.
Yeah, very good. Well, let's kind of start with the basics. Why don't you tell us a little bit about yourself and kind of your history and your work in mental health, and maybe how that lends itself to the consortium?
Yeah. Just my history myself for mental health, my services in mental health, I guess. I actually started at a kind of a paraprofessional role. So basically at a community level, and I worked with foster and adoptive kids, and that was based off of our own personal experience. So as a foster adopt family, we're a blended family. We had our girls join us. Our girls joined us at the ages of 6, 8, and 9, and our biological son was 7 at the time. And so just some of the things that we had gone through and understood about trauma-impacted youth and how that just understanding the blended family factors, the challenges that we had, just working together and establishing a family, the support systems that we needed. And as a result of that, I was able to help others on their journey. And so that kind of started for myself, my own lived experience, started me in working in different mental health adjunct programs, different support systems for families, and then it kind of grew into my own clinical career. So I've been doing private practice for over a decade now, but I've been working in the mental health field for, I don't want to age myself, but for a while. But as a result of that, I really see, the value of just understanding lived experience and how lived experience can actually improve your ability to help others, and even at a clinical level. So,
well, my gosh, what a giving soul you are!
Yeah.
Three adopted children, and your own child.
We always say that they blessed us.
Yeah, very good.
In different ways.
Yeah.
Yes.
And I could see that when you probably have adoptive kids coming in, there's probably different issues with each child and coming in and trying to kind of figure out how to help them and best get them acclimated to your home and that kind of thing. So good on you. And that's probably transcended and kind of brought you into this kind of outreach, if you will.
100%. And I think part of that too is exploring different creative ways of meeting the needs and looking outside of just the standard practices and really having to take different creative approaches. And I think that that's really lent my skill set towards our behavioral health consortium locally.
Very good. And let's talk a little bit about that because maybe not all of our listeners know about the Behavioral Health Consortium.
Right.
But tell us a little bit about that project and what its mission is and what its intentions are.
Yeah, well, I think I want to start with the word consortium because I think people find that really challenging. And a consortium in and of itself is just, in my mind, this is I don't know, my definition would be pooling resources together within an industry to creatively address an initiative or a need. Yeah. And so for us, it's the workforce development and behavioral health. We have a true workforce shortage in our community. And so our consortium is really driven to creatively look at ways that we can help to support building professionals for the behavioral health field.
Okay, very good. I kind of noticed this back during COVID. We had a real downturn in social work. It seemed like to me. I don't know that the people necessarily went away, but we just didn't have the same resources. It seemed like thereafter. But maybe that's been going on before that. Maybe it's been.
There's a couple different things. Oregon overall ranks very low in the nation's healthcare and mental or behavioral health. We rank 49th in the nation, so we're very, very low. And in rural communities, we're impacted even harder. So pre-COVID, yes, we still had some challenges. We always have challenges in rural communities, especially. There's different reasons, and we can, look at those as well. But in general, COVID really just challenged the healthcare industry just overall medical, mental health, you name it, and all different levels, not just social work for behavioral health, but just all different clinical levels. So if whatever role or level of education those different positions held, all of them have been impacted by,
Very good. And so is this consortium a bit of a reaction to that, to develop more skilled outreach, or and let's talk about that. Like, tell me a little bit about what these folks do and how they're helping people.
Well, we looked at, first off, under the Columbia Gorge Health Council, we had a behavioral health advisory committee. And as a result of that, we really looked at the biggest area of need is workforce development, workforce retention. And so if you look at just in general, healthcare and workforce initiatives, we really look at having to recruit, how are we going to maintain and sustain people in the industry, and then what's the retention? Like, how do we work on that, develop that piece? So we kind of furthered it. We looked at different data sources and assessments. We have the Columbia, the community health assessment that is released through our health council, but we also had an MBA cohort through OHSU that came out and did kind of an ease and impact assessment of how can we develop these areas. And so as a result of that, one of the things that we looked at is how do we have a consortium here? How do we unite our or pool our resources here to creatively look at different ways to build these areas.
Okay, and is that kind of like one hand knowing what the other hand's doing? Like there's this kind of creating this network, this group, and I can discuss all these issues.
I think what we're trying to do is really shift the culture of the way that we're addressing a problem or a concern, which is needing more, to build the workforce. And pulling it away from the different silos of care. If I'm providing services in private practice, I'm an individual working in an isolated individual status, right?
Okay.
Agencies work in different silos of care. And really what we're trying to do is cross-sector and pull everybody together to create a sense of community, to address the issues as a team. If there's shortages in some areas, how can we pull from our resources that we have, even from private practice, to help with the agencies? How can we assist with the agencies and their development or training for their staff? So it's really just kind of working together. And so, pulling away from those different isolated silos of care. And the hard part too is just shifting that culture. That's a mindset that's been established for so long. We really have to kind of shift it to see what we can do together, right?
Yeah, I know Wasco County Sheriff Lane McGill has talked a lot about this and trying to dive into kind of more resolution minded ways of working with folks who are interacting with law enforcement, folks who are, either below the law in some way or another, but maybe there's a mental health issue there or behavioral issue of some sort. And so, like, when we're talking about this, like, what kinds of, can you give me a few examples of, like, like, say, folks who are needing some help, but maybe not necessarily getting it, and, like, how this consortium might reach them, or how this consortium would help, reach that person? Like, I'm not giving you a very good example. Maybe, Robin, you could chime in here a little bit, but...
Well, I mean, back to Stephanie's point of, like, the mental health issues in a person exist no matter which provider they go to.
Right.
Okay. And they don't change if you go from one provider to another provider. A person's mental health issues stay the same. And it can be very hard to move providers. We know this from going to the doctor, right? Okay, now we're going to take a 45-minute history, medical history, which is always broken when you give it to you from yourself, from your own point of view. You always forget things, right? You haven't written it down like a nice list, and so there's a need to collaborate, right? There's a need to bring people together and to streamline processes, not just in the clinical side, but in the workforce side. Because,
overall.
Because it's complicated. Clinical workers, you need a lot of supervision and like a lot of, we don't just. The person doesn't just jump into clinical work and now they're working with patients. There has to be care there, right?
Yeah, and I wanted to add to it, like, our mission is really, this whole workforce initiative is based on, ease and access for people, for the community to access care. And so more to your point, we need more providers. We have limited resources. If we don't bolster our workforce and build it, we don't have access to that care. And so even accessing or switching providers, just limitation of providers. And if you look overall, the complexity of needs in mental health are on the rise. And I don't have concrete numbers, anybody can look it up, but we're talking mental health needs, the acuity, like the level, the amount, it's everything's growing. And so, but we're not growing as providers. Like we don't have the growth to meet the needs. So we can't access or switch or have to, it's just, we need more providers at all different levels, to your point, like not just clinicians, but just all different levels. So
I mean, it's like going to we don't perceive going to the mental health provider like going to the doctor, right? And, we'll go to the doctor for flu or, a cough, but, we'll often live for months or maybe years with anxiety or depression, something like that. And that's kind of normal, right? And so when we treat mental health more as the holistic point of somebody's health, and like you need good mental health to be a healthy person, right? I need to be in good mind to not go eat junk food, for instance. That's my that's my journey, right? Like when I'm stressed out and like, life is tricky, I'm like, give me a cheeseburger, And so I'm using a benign point, and the mental health is obviously really serious for loads of people on loads of levels, and I'm obviously making a joke out of it. But I mean, when we think about mental health as a holistic health point of view, there's way more to do.
And it seems to me, at least in my own experience, that mental health never really came into my picture until I was in crisis.
Right.
Rather than treating, kind of the systemic problems that were leading to that crisis. But I had boundary issues. It's kind of what my thing was. But like, it was really revealing when I actually got in to see somebody who, it didn't take them very long. It took a couple of days, and they were like, "Oh, these are boundary issues. You're thinking of everybody in the same way, and it doesn't work like that."
Right. Just giving you a different perspective. And sometimes externalizing those thoughts or being able to understand them in a different way can put a whole different scope on things for individuals, But and I do think you're right. A lot of times we don't access it until we're in crisis, and there's several different reasons. There's barriers to either the access to care, and also, we're sharing a lot of ourselves that, typically we just don't reveal to others. And so it's really having to build that rapport and trust a provider and really know that you can be able to share that experience with them. And so a lot of times we even look at like the paraprofessional role. I say that, and let's change it over to, there's so many different lingos or names, but community health workers are a basis of our community. That's kind of when we look at recruitment for workforce, that's kind of our entry point in. So those are our traditional healthcare workers. Those might be our family service workers, similar to a role that I experienced in my career growing. Growing
That's kind of how you got into the profession, if you will, right?
And
that
so
was your
starting,
entree.
those are kind of the entry level positions, but those are the people that really can build trust within a community that might be establishing, that might be facing hardships, and really can have somebody that they can trust and build that, and that can help people ease into seeking higher levels of care. So, I mean, that's really why we really want to focus a lot on those entry points in that community health worker role, because it's really important to get those people in and start in their career path and their journey. It's really important.
And what a fascinating job, right?
Yeah.
If you want something that's different every day, and you're going to be faced with real human challenges, and have the reward, the reward of being able to actually help them in some way. It's connecting to services in many cases, but that first step is super critical for somebody changing their outcome.
Yeah,
right?
Absolutely.
What a great thought. Why don't we return to that after we go out for a word from our sponsors, and we'll talk a little bit more about how folks might get involved in the profession.
Yeah.
All right. Hey, Robin, did you ever try to drive a car with 3 tires?
I have tried that a few times. I tried to get up on 2 wheels, but you need a really good ramp and definitely a helmet so you don't bang your head.
Well, it's a good thing that Columbia Gorge Toyota are having a buy 3 tires, get 1 free sale right now.
That would get my car right. I like that. My dipstick's also really black. I have gone goth before, but this is taking heavy metal to another level.
Oh, man, right? Well, Toyota's also offering $16 off an oil change. That bright yellow conventional or synthetic oil is just the thing to make your motor happy.
Nice.
And here's something to keep you headed straight.
Is it a ruler?
No, but good idea, Robin. Actually, Toyota offers a free alignment check, and they'll even make sure your tires are in good rotation.
Tom, you know I just can't do without my car on some days, and it is a Facebook Marketplace purchase, so it's a little tricky. Will I be left waddling up and down the sidewalk in my tennies?
No way. Columbia Gorge Toyota has a one-day complimentary rental car service on repairs that total over $500.
Whoa, that's free ride. I love that. Is that from our friends at Columbia Gorge Tow to Rachel and Aaron Carter?
You bet, making your life easier and your car safer with quality repairs and service.
8 a.m. till 7 p.m., Monday through Saturday, 1900 West 6th Street, The Dalles.
All right, and we're back with Stephanie Becker. We're talking about mental health today, and also just starting to get into a little bit about the mental health workforce, and maybe chatting about how folks who are interested in the profession or in helping others might connect and get involved in the profession. So,
Yeah.
Can you tell us a little bit more about that?
Yeah, well, and from the consortium's efforts, for workforce development, I was telling you that we kind of looked at different levels of that, or different areas that we really needed to focus on. And so that recruitment piece is so extraordinarily important. But once people get involved in like an agency or in a role, even at a community health worker level, there's different ways that people can get involved in mental health. It's not just at a community mental health worker role. But a lot of people are furthering their education, or they're in the system and they want to move up in their education. And the biggest thing, the consortium, for us, we really need to look at how are we providing the support systems to either get people here in the roles, when they're in the roles, how are we supporting them in that centerpiece? And, it's hard because there's different facets for mental health. When somebody goes in for their education, they have to do a field placement or an internship. And if we don't have an internship here, typically they're not paid. So there are some barriers with income. If we don't have an internship here available, we're going to lose that person, and they're going to go to an internships that's available most likely in a metropolitan area. So we want to make sure that we're developing internships. If they have a good workplace experience, they're going to most likely stay in that agency or seek further work in the industry here. So the consortium really looks at how can we offset some of the cost? Can we provide them a stipend while they're in that role? How do we develop internships in general? It's a big, big piece for that, capturing that front end, that recruitment piece. Also, we want to look for the consortium. We want to look at how are we providing clinical supervision. So this is a big piece that most people don't understand. When you graduate as a professional counselor, as a master level social worker, once you graduate, you have to gain clinical hours under the purview of somebody that's licensed. And that is board required by our state. So what we have to do is make sure that we've got that clinical supervision. That piece costs people out of pocket if they're not being provided through an agency. Agencies might not have the resources. So again, the consortium looks to pool the resources. How can we pull from the private practice clinicians into the agency? What we don't want to do is have that person leave and go somewhere else, where they're going to find that they can find that in an agency, maybe in Portland. And so they're going to work there. We're going to lose another provider in our community. So we look at addressing those key pieces. We also want to make sure that even people that are at whatever level that they're at in their career and their professional development, that we are finding the pathway to get them into a higher level of education, or what we need is ongoing continued education units. How can we tap into our community's resources in the areas of specialty and have those clinicians provide that education back to people that might be at different levels in their journey? And also evidence-based practices are something that provide people with ongoing skill sets to reach our gaps and our care inefficiencies. So meaning like we just don't have enough child providers. We don't have enough providers that are providing services for mental health for children and at younger ages. So how can we educate people to feel like they've got a greater skill set to help them there? So I hope I'm answering your question, but I'm going into depth a little bit more.
It's interesting. So the consortium cast is really broad now.
Yeah,
it
it's
feels,
huge.
It kind of provides kind of like filling in the gaps. Like say you might be able to get enough supervision, through a clinical situation, but also then you might draw on an agency to get some additional hours or something like that. Like,
right.
Could you kind of spread the load that way through your network?
Well, that's what we're trying to do is like, I mean, in essence, like if somebody's working in an agency, but they don't have a clinical supervisor, then what we can do is the consortium goes and looks at, we've actually worked on educating and getting people prepared in the private practice sector so that they can provide that supervision. So now we've got people that are geared up and ready to go. So now we can have somebody provide them clinical supervision. They have administrative supervision under their agency, but the clinical hours that they need can actually now be provided, and we can keep that person in that role.
This just sounds imperative, especially in a rural area like this when we don't have the larger institutions like you do in a metropolitan area. So this is kind of interesting. So who came up with the concept of the consortium? Like is there a seminal story here? Is this in the last year or two, or?
You know what? It's funny. Gabby Swisher and I had been working on this. She was over at Pacific Source as oh my gosh, now I'm going to forget her title. Kind of just working on just overall looking at just healthcare in general and what we need in the community. And, we both, we're talking about it, and I was sharing with her that there's consortiums in different areas. This is kind of just an ongoing mindset. Just Oregon statewide is kind of on the onset of doing more consortium work. But when we looked into it, it was really interesting. We have a consortium that is the Eastern or Central Oregon Behavioral Health Consortium, but it's interesting because when we reached into it a little bit further, their reach is here, but the funding wasn't, and so they're not here, even though they are.
Is that more Band Madras oriented?
Yes, yes. So we've actually utilized them as a mentor to us in developing it within our community.
Makes sense, yeah.
But it's really interesting. Even at that, we realized that they have a different demographics than we're facing here in a rural community. Yeah. And I think one of the biggest things that they have is I'm going to call it a feeder source. They sit on top of a university that actually provides ongoing clinicians that are going through educational levels. Mm-hmm. And so they have a university there that can help them to kind of feed into their system, right? Oh, yeah. We don't have that here. So what we face in our community is that we've got all these people working through different online programs, and we realize we've got to create a hub to be able to provide support. These people are going through these online programs on an individual basis, and usually very under-resourced or connected. They don't know where to connect in. They don't know the sense of community out here with clinicians, and really trying to create that has been it's been a larger task. So your question is who came up with it? I think we just collectively, the advisory committee also helped to guide us. We always lean back on them for support and guidance and direction.
Are kind of the kind of elements that you would have at a state school or a university campus, maybe where there is that kind of hub kind of built into the program, or
typically,
maybe I'm out of.
Typically, the universities would be connected individually with agencies. The agencies know, so they just kind of have like an ongoing way of connecting and locating the internships, field placements, getting people into their system, helping them with the supports as they're at the tail end of their education and moving on postgraduate level. So, but we don't have that here.
Gotcha. Okay.
Yeah, it's a double-edged sword too, right? There's this for these people going through these programs, right? You go get the education, and then there's this wonderful opportunity to kind of work and grow in a career, right? At the same time, which is just awesome, right? And so many jobs and careers, there's limited growth potential, both from kind of all levels, from kind of understanding and education, and also from a payment, from getting paid and things like and salary levels, right?
Right.
And so on one side, we've got it's a great opportunity for people to go through working at the same time as growing in their career to become really high-level clinical people, right? And you can go all the way to psychologist or get
you can go to a doctoral level. Absolutely,
you can get an MD, right? In this, and so, but then if we don't have the full gambit of that job pipeline in terms of that education along with the internship and the supervision, then we don't benefit from it because, as you say, they have to leave and then they have to come back, and then we have a housing issue, right? Where kind of like landing in the gorge is kind of a hard thing to accomplish without family or friends here to kind of stay on the couch for a couple of weeks while you find a rental. And so all these issues are kind of feeding into each other, right?
Yes, and I want to go further into that, but
we find that to be true for sure. We generally have to find people locally who are already established. You know, as far as CCC News goes, and is that kind of a similar situation?
Yeah. So that's the kind of the fourth area that we really focus on for the consortium is building that pipeline from the community into the workplace. And this is a very fragmented, long journey. So if you capture people at that onset, at that recruitment area, like we said, at that, at the beginning stages, it can be quite challenging because it's a long process to go through your bachelor's, master's, if you're going up to the doctoral level. So creating some form of support system to guide you through that and have that sense of community is really what's going to keep people involved in that, so that they feel like there's a sense of value and purpose in what they're doing and the sacrifice that they're making in their education and moving through. They can work in the same, they're getting their education, they're providing a workplace experience, but the shortfall sometimes is they don't get paid for that workplace experience. So now they're enduring another economic hardship. The recruitment piece of getting people here and looking at stipends to, for relocation, it's challenging. I think that's the biggest thing. Like you're experiencing here, we experience it in many, many different areas and workforces and workforce efforts out here. We just, it's too hard to get people here because the cost of living is way too high, right? Yeah. So building a pipeline from the community to the workforce can help us with overcoming that in the long run, right? This is not a quick fix. But the other thing is it also then it actually works with the diversity and the makeup of the community. So now we've got people that are experiencing the challenges of the population, the diversity, the cultural diversity. I mean, like the demographics can now match in the workplace, instead of just pulling people in from different areas. Yeah. So really, there's so many benefits. Truly interesting. I went to an educational, conference at a university. And one of the things that they looked at, it was just mimicked throughout, and this was nationally, but people are looking at this pipeline into the workforce initiative or efforts. And it's really something that is really driving a lot of creative workforce initiatives to look at how do we build this kind of roadmap into or pathway into the workplace. Yeah. Is this to Pete? From your experience and the way that you interact with your colleagues, is it rewarding career for people? Oh yeah, there's a true sense of value, but the challenge with that is the high workplace burnout. Right? Because a lot of the work that we do is in silence. It's behind the scenes. You don't share this with others. There's HIPAA reasons. There's, privacy issues. Yeah. You're really experiencing a lot of complexities and a lot of trauma from others. And so it's very, very rewarding to be able to help and guide others in the changes that they're seeking for themselves. At the same time, it's very challenging because there's a high level of burnout with it, right?
Yeah, with that ton of energy.
Right.
Really meet people where they're at and listen
and super important that way to have community and support, to have colleagues that and to really bolster and help our community of clinicians know that they are valued, that we honor and respect the work that they're doing. And so, and we've got some great ways through the consortium that we're looking at that right now, and some events that are coming up and ways that we can help support our mental health workers. Yeah.
Excellent. Well, let's talk about those. First, we'll go out to our sponsors, hear a quick message, and we'll come right back and we'll talk about some of those things going on.
Perfect. Great. Thank you.
Hey, Josh, did you know that we are funded by our readers in large part?
I did know that, but please tell me more.
Yeah, it's our local readers here that make it possible for us to go out and gather news on local businesses and important issues in our community. And so we need people to support local news. Did you know you can make a difference in our community's economy and culture by supporting local journalism? I bet you did. But maybe you out there don't. And so you should visit our Support Us page at CCCNews.com to subscribe to a monthly donation to keep news local and start making a difference in our community today. Again, that's CCCNews.com.
And remember, CCC News is available for everyone and funded by readers.
All right, and we're back. We're here with Stephanie Becker. We're talking about mental health and the Columbia Gorge Behavioral Health Consortium. And hey, we've got some interesting events coming up this month in regards to mental health. So tell us a little bit about that, would you, Stephanie?
Absolutely. We've got some other, workforce efforts and the events that we're doing, but I think the main one right now that I want to share with everybody is that we are, for Mental Health Awareness Month, we are focusing on honoring our mental health professionals in our community. Like we were saying earlier, we really want to highlight and showcase the value and honor the work that they do. When we look at mental health in general, we look at just having a shortage, right? We don't have enough, but why are we not focusing on the providers that we have and really honoring the work that they're doing?
Right.
Especially when they do a lot of it, like I said, in silence or behind the scenes. Mm-hmm. So we have an event. We are inviting the mental health professionals there, but the big piece of this is really I want to share that we are nominating mental health professionals, and that can be
cool.
at any professional level. So if it's a community health worker, traditional health worker, if it's a case manager, clinician, if it's a psychiatrist or somebody at a higher level, whatever, doesn't matter. It's just we have nomination forms available. We have them in English and in Spanish. They're open for the public to just if they've been touched by somebody in the mental health field, a professional that they've worked with, if they want to nominate them and let us know their experience and how we can share that with them or share it with others. They can do this anonymously. We don't want anybody to have to share any information if they don't want to, but we want to know if we can share this message, inspirational message with others. And so it's just a great way kind of just to help them to share the work and just to really,
hold up those local heroes, those people who are putting in the work every day.
Absolutely.
100%. And giving them a pat on the back and giving them a reason to continue on and to do the work,
exactly.
It's really important. I think I go back to your point you were just talking about a minute ago, about retaining the people you already have.
Right.
And that's so important and giving people
kind of the boost, right?
And letting them, achieve their purpose, but also like letting them know that they've really helped our community.
Yeah.
So that's great.
Yeah.
I'm really glad to hear that. I was going to also ask you another question. And, backing it up a little bit, probably should have put this in the front end, but can you kind of just hit on the breadth of mental health work? Can you talk to me a little bit about childcare up through, helping, an adult maybe with an issue or something, but just kind of briefly give us an oversight of all those different venues that are different avenues, I guess.
Healthcare. I mean, I definitely, there are a lot of different areas. So I think for me in a workforce endeavor, the first thing that I think of is where are our care and efficiency gaps? So where are we not serving populations enough?
Right.
And I'm going to say in general overall. Yeah. But as I mentioned earlier, we primarily our community health assessment has really highlighted that we are needing more providers for children and adolescents. In that field, we really have the greatest care and efficiency gap. And we've got some great agencies that provide services in that area. And, I want to highlight and showcase that they're really trying, but we definitely need more providers in that area. If it's peer supports, even for teens, we need those community health worker roles. There are some availabilities in the community. I'm actually going to be attending the Columbia Gorge community college career fair tomorrow.
Oh, great.
Just so that we can talk about some of these opportunities. But yeah, that is primarily probably our biggest gap. So I'm not sure if that answered
No,
your
yeah,
question.
it does. It's
but-
exactly what I was curious
Yeah.
about. Is where do we need to increase the
Efforts,
numbers,
yeah,
the
right.
effort? Yeah.
Yeah.
So, okay.
That really reflects some of the things that are going on in schools. You know, I work with the school board here in the Dalles, and there's with restorative practices, with the new kind of way of not kind of disciplining kids and more like helping kids be less disruptive by understanding why they were disruptive in the first place.
Right.
That's a very high level kind of look at that. You know, there's a greater need for school counselors, early mental health, childhood consultants, these types of people, right? And they've been trying to hire those positions for a while. They're very hard to hire, very hard to find.
They are, and that's where I'm going to reflect back to internships and just trying to build those internships there. And even if it's with the consortium support, that's some of the things that we look at. Like, how do we even when we think about mental health and mental health providers, we kind of tend to think of just an agency or somebody that's in private practice. But there's different areas all over. There's juvenile justice, you mentioned, or there's justice systems earlier. You mentioned that. There are school systems that have counselors that need extra support or additional. I mean, that's one of the things we look at is, there's these, people are trying to hire, and sometimes those positions can remain open for a really long period of time. And if we looked at, well, then how do we create an internship, and can even the consortium provide some external supervision and support to get that person in there? That's part of that, just kind of creatively looking at how do we address, even just if we can't hire, how do we get somebody in those areas? So definitely something for us to focus on. Yeah.
Very good.
Absolutely.
Yeah. So very good. I'm kind of, I guess the consortium, is it a group? Do you guys have a board, or how do you?
We do have an advisory committee. So we still run under the Columbia Gorge Health Council.
Yes.
And then we have our own advisory committee. But I should just help to understand too, this portion that we're grant funded. So we utilize community funded dollars, and we are finding ways to to further that, to put those back into the community. And that's through those internship stipends and through the supervision support, just community endeavors, educational interests. We're just looking to put those those community funded dollars back into the community. But we are grant funded. And as we look at the general makeup of funding in general right now, we're doing what we can for as long as we can.
Very good. Very good. Yes. You guys have a wonderful website. I was on it earlier this morning. And
Thank you.
Robin here has helped us with that a lot. So thank you so much.
That's probably a good way to make for folks to make connection.
Absolutely. That's a great thought. We connect through that. And actually our nomination forms, I'm hoping that we can send them out to the community, but they will be available through our website as well for our Voices of Healing event that's coming up in May. So absolutely, that would be a great way for us to really spread the word and help and get people involved to some degree, or just even knowledgeable about that we're trying to help in the workforce and build that so that there is ease and access to services for our community. Yeah,
look out for the link to nominate folks in the description of the podcast and the story.
Oh, great.
Because it should be right there. So do click on the link, folks, if you see that, and if you've interacted with mental health at all, we'd love to hear about your favorite providers and why they were so great. Great, inspiring stories for sure.
Absolutely. Yeah. Can we get that website? Do we is it a?
It's CG behavioral.
So I always do. It's cgbhconsortium.org.
Okay.
So that's the easiest way to find it. It's a long
That's fine. Can you say it one more time for us?
cgbhconsortium.org.
Ah, perfect.
Yeah.
Thank you so
Yeah, absolutely. And my contact information is in there. So if anybody, even if they're interested in just kind of, exploring what these opportunities would be like for them, if they're, if there's some kind of something that's drawing them in, even if it's their own lived experience and they're thinking, wow, maybe I would be able to share this with others or help others.
Right.
There's a pathway. And so, we would like to explore it with them. They can reach out to myself. My information's on the website, so we can do that. I will be at the Columbia Gorge Community College career fair.
That's tomorrow, Friday?
That is going to be on Friday. Yeah. The 17th. What day am I on? 18th. Thank you. The 18th. But yeah, so that is actually, and job seekers, that is the opportunity to be there is in the afternoon. I believe in the morning it's going to be for high school, just high school education information for careers. And also just getting involved and sharing information for nominations for our event would be amazing to support just honoring the workers in our community.
Yeah.
Yeah.
Very good. Well, what a great way to get involved. Give somebody a pat on the back.
Absolutely.
You know what? You talked about the assessment too, and in that, did they come up with? Did they have any numbers? Like, did they we need 30 or 40 more people or 50? Do you have a feel for that at all?
They look at Oregon Health Authority's kind of ratio, and that's there's different data sets that they look at of how they come up with. So are you talking about just for numbers of provider shortages?
Yeah.
Or,
do they have a sense of that?
I mean, that is on the Columbia Gorge Health Council's website, and they have the CHA, which is the Community Health Assessment. So they have an executive summary, they have a full report that's on there, and that's for all social determinants of health. So that's medical and mental health. That's on there as well. But yeah, there was one number that kind of struck me that out of the people that they had met or interviewed, this is then quantitative information, but only 30% were had the ability to access the services and mental health that they needed. So in general, that means only 30% of our community, overall, if we looked at this on a bigger picture, has the ability to access services that they need for mental health. So it's just a truly, truly huge need in our community. Right. Yeah.
Cool. If there's let's to wrap up. If we could all do this. Is there one thing I can do to improve my mental health? What would it be? I mean, it's different for everyone, but like soundbite world. What would
I think what you really want to do is just internally focus on one small shift that you would want to make for yourself, and then really kind of look at problem solving that. What supports and resources do you need to get yourself there? What's one small thing that you can be doing to actively work on that? And not to focus on it as like a shortcoming if you don't get there, but every day kind of just looking at, potentially you didn't do it in the past, but now today you're working on it. So, and I definitely am always about, accessing mental health services where they are available. It's just, I think improving it that way, but finding value and purpose in what you're doing is really a significantly huge piece of, improving your mental health in general.
I would say mine is focusing on one thing at a time.
Yeah.
I am constantly getting fractured, if you will, like phone calls, text messages, that kind of thing. And I guess maybe that's turning, the messages off for a while or
possibly, and right there, just focusing on, turning the messages off for a while. And that's it, just one thing that you can do to improve. I definitely feel like, when we look at mental health versus behavioral health, mental health is really the constructs of just focusing on our thought process. But behavioral health in general is a holistic approach. So we really want to look at all physiological states. What are you doing overall that's improving your mental well-being, right? So that's not just,
basic, like sleep, right?
Sleep hygiene, active outlets. A lot of anxiety and depression, we can counteract that by just taking a walk, just being outside, connecting socially, doing something that we want to focus on. Sometimes we feel like there's a shortcoming, like nobody's reaching out and talking to me, or no. But then what are you doing for one day, maybe 10 minutes, just to reach out to connect with somebody else? That's fulfilling yourself. So different ways that you can look at it, but
Nice.
I don't know, Robin, what are your thoughts?
Certainly, the morning walk is life-changing.
Yes.
For sure.
Right?
Yeah, and then just get out for half an hour with the dogs.
Yes.
And I even, I struggle with the dog park in the morning, and like for me, the first hour of the day, if I experience something stressful, it kind of stays with me for like the rest of the day. It's pretty hard to pull that cortisol level down. And, and it's a scientific thing. If you wait, your cortisol's a hormone or a chemical released by the brain in the morning to help us wake up, right? But it's also a stress hormone and a stress chemical, right? And so if in the morning I kind of look at social media and get triggered by someone's, trolling comment, like I really struggle to let that go for the day, not because the comment is really bugging me, but just because my energy level is higher. So for me, it's leaving the phone face down in the morning, except for a little email, and going out for a little walk and listening to the birds.
Which you've always done since I've known you.
Yeah.
Yeah. Good.
A good practice.
I try, yeah.
Good practice.
Mental health wasn't always good. And so, I have to make an active effort to do that.
Good.
For sure.
Yeah, that's awesome.
How about you, Stephanie? Do you have
You know what? I have been a runner. I have to run, and I'm not running any marathons. I have done that at one point in my life. I will not go back to that. But I call it a jog, like I jog walk.
Nice. Yeah.
But I think that for me is just, whenever I'm stressed out, the one thing you don't want to do probably is be more active. The one thing I know I need is to go out and go for a little run and decompress. So I definitely have to integrate that through my week, because those are kind of my decompression points where I have to that's my release. So that I try reading, I've got my little dogs, good stuff like that. But you know what, when I can access it, I have to go for a run.
Yeah.
Yeah.
I love that advice, a little bit at a time. And,
Yes.
work towards your overall improvement.
Yes.
Yeah.
Yeah.
Great.
Yeah,
Wow, well,
fantastic.
Fantastic. Thank you so much for coming and chatting
I
with
so
us today.
appreciate this. I really hope it kind of inspires others. I hope that people get out and not do the nomination form and honor people. It's that's another way of feeling like you're contributing and helping others in their journey and inspiring others. So I think that that's amazing. Thank you for allowing us, for the Behavioral Health Consortium, to be here today and to share kind of just our workforce initiative and what we're doing in the community with others. So
Well, I think you guys are trying to lift everybody up in our community.
Yeah.
So thank you for that and your professionalism.
It's
your
greatly appreciated.
Thanks.
Thank you so much.
Yeah,
right.
Thank you for all the work you guys do too. Thank you.
All right. Have a great one.
Thank you.
Thanks.
Bye. Hey, Robin, I just did a story this morning about my daughter who's hiking the PCT.
That's special. I love that.
Yeah, and she's a 2019 grad of the Dallas High School, and she's doing this kind of awesome thing, and I'm so proud of her. But also at the same time, I really enjoy bringing local news to folks and bringing relevant information.
That's really evident from your work, Tom.
Yeah.
Yeah. I mean, the internet is full of misinformation or poor quality information or AI produced information. And here we have something different at CCC News, right? We're local people generating local content with journalistic integrity and trying to build trust with our audience because that's what they deserve, right?
Right. And so how does that benefit our advertisers?
Well, being seen next to content that's really relevant, that's really trustworthy and really credible adds credibility to our advertisers because our viewers and readers see those advertisers next to that really honest, credible local information, and it really builds that brand into a basis of trust and really helps businesses reach people from that basis of trust.
Yeah, awesome. And boy, and to all those folks who are supporting us, it makes a huge difference in us being able to get this job done of keeping folks informed of what's happening in local government, entertainment, all all sorts of venues throughout the gorge.
Yeah, we have really high integrity in our journalistic standards, and so you're always verifying all this information constantly with multiple sources of people. You know, we don't try not to do one source stories here, or just take a piece of information from the government and run with it. You know, we really try and drill down and get to the meat and potatoes of what's there.
That's the joy. Yeah.
That's great. Well, if you want to keep reading, go to CCCNews.com. And if you want to support us, look for our supporters tab there. And really grateful for any support that people can make. Yeah. The more support we get from our local audience, the less we have to rely on advertisers, and the more journalistic freedom we get.
Yeah, absolutely. And those interested in advertising can always reach out to me at tom@cccnews.com, or call me at 541-980-2756.
Great. Thanks, Tom.
You bet.